One of the biggest issues that we know we're facing is bringing doctors to Long Island, as someone who's trying to hire physicians, and we're all having an issue bringing people in. And patients see this is when they call it 6 to 8 months to try to get in to see anyone. And the question is, why is that happening in the state that 1 out of 4 residents are in the country are in New York, but why are they not staying here? And some of it has to do with the high costs that all of us, regardless of what we do, face on Long Island, but some is very specific to medicine. And for us, it's the malpractice. It's a malpractice. Our rates are significantly higher than any other state in the country. We pay out more in malpractice claims than any other state, including double the number 2, Pennsylvania. And this translates to physicians who are close to retiring, who decide to retire early, and we can't simply replace them. And now we're looking at an existential crisis getting worse with this wrongful death that unfortunately that is now sitting with the governor, though may end up back in front of you like it did, already. This is the second time through.
The ability for me to be insured, I went the expensive way because Medicare Advantage is going to contest every medication I take. And it's not even a question of going down the checklist. The checklist here is if the medication is on this list, it is denied until a prior auth. And there's a time factor there. So we have patients that are not getting treated, not taking medication. As you know, I was working down in the Valley Stream, Lynbrook area, seeing a lot of South Queens, and the underserved communities are full of people that sort of give up.
I got to re-up the authorization and nothing's changing. So it's just adding a lot of roadblocks and administrative burden on the practices and forcing us into, prescribing things that we normally wouldn't choose that's best for that patient as a path of least resistance. So this isn't a way of the insurances almost practicing medicine by telling us, what we can and can't do, and to have to reauthorize things every 90 days is burdensome when they've approved it the last 6 times. They're just adding administrative work to save themselves money.
Prior authorization has been an issue for a very long time since I was a resident. We keep talking about it in AMA, in MESNI, and so now we have come up to even looking at the definition that why it came into place. The intent of prior authorization was to decrease the medical cost and promote safe, efficient, and evidence-based care. Now, whenever we talk about evidence-based care, it's about the surveys. AMA did multiple surveys because of the problems originating from prior authorization. 94% of those who access necessary primary care, they have been delayed or denied even the primary care because of the prior authorization. We are talking about a high number, 94%. Patient outcome has been low by 90%, and these surveys are online, and patients have abandoned treatment by 80%.
So this bill would urge enable independently practicing physicians to come together to advocate on behalf of their patients. So as you know, the market is dominated by certain health insurers, and many who have independent practice, including some on the call here, it's very hard for them to survive in this world. So we ask for you to support this.
I think the common thread behind all of this is we really, really want to make it a hospitable environment for us to continue to treat your constituents, our patients. These are the same people. We just want what's best, and we really appreciate your attention, your concern with all this.
So we need to chip away at some of these problems, and I am very happy to have the relationship with you that you can update me on what you're facing and give me the background, because you've obviously seen what I've done in the past session. I have no problem standing up and advocating among my Republican colleagues and on the Senate floor to everybody to say this is wrong, we need to change this, this needs to be better.
The medical profession, along with every other profession, changes and changes dramatically. And I know it is not easy. For example, prior authorization is not only intimidating, but it truly is punitive. I'll do anything and everything I can to help make us better as a nation and as a community. But you have to promise you'll stick in there as well.